Hello, I'm Michael Aubin, President of Wolfson Children's Hospital. Wolfson Children's and our pediatric healthcare partner, Nemours Children's Health Jacksonville, are proud to present this sports safety education video, also brought to you by the Florida Alliance for Sports Medicine. High school sports in Florida are exciting, and it's so much fun watching kids compete in the activities they love. We don't like to talk about it, but we know injuries can happen when kids play sports. This video will introduce parents to policies set in place through the Florida High School Athletic Association to protect student athletes. Some injuries, such as heat exhaustion, heat stroke, and concussion, are preventable by taking proactive steps, as the video will share. Experts will also cover sudden cardiac arrest, a scary condition often associated with sports that can be prevented with a comprehensive pre-participation physical. Please consider scheduling a sports physical for your child with a local pediatrician or primary care provider. Good luck to your athlete, and thank you for being part of your school's sports safety team.
The Florida Alliance for Sports Medicine, in cooperation with the Florida High School Athletic Association's Sports Medicine Advisory Committee, welcome you to a discussion on safety in high school sports. My name is Bob Sevchik. I'm a certified athletic trainer with over 30 years of experience. I am the CEO of the Florida Alliance for Sports Medicine and a member of the FHSAA Sports Medicine Advisory Committee. I will be serving as the moderator of this educational program. This program is designed to educate parents and student athletes who are participating in high school sports throughout Florida. The goal of this program is to educate you on some of the injuries that are common in high school sports and to make you aware of certain safeguards and policies that are in place to keep you safe while playing sports. Ultimately, the program seeks to remind and empower both parents and student athletes of their individual important roles in safety and injury prevention while playing high school sports in Florida. Thank you for taking time to view this sports safety discussion. As we can all appreciate, sports are an exciting experience for our high school students. When participating in sports, there is always a chance for injury. Sadly, some of these injuries can be catastrophic. Today's discussion is meant to familiarize yourself as a parent or guardian to the safeguards that are in place through state law, FHSAA policy, or through rules and expectations set by individual schools that exceed those in place by outside standards. Since this recording is not a live format, we encourage you to seek answers to any specific questions from your school athletic trainer or athletic administrator. Joining me today for this recorded presentation are several members of the FHSAA Sports Medicine Advisory Committee, including Dr. Jennifer Maynard from the Mayo Clinic in Jacksonville. Dr. Maynard is the Director of Primary Care Sports Medicine Fellowship at Mayo and serves the FHSAA as the Chair of our Sports Medicine Advisory Committee. She is also the Primary Care Medical Advisor for the Women's Tennis Association Professional Tennis Tour. Dr. Eric Corus from the University of South Florida Morsani College of Medicine. Dr. Corus is a professor of family medicine and orthopedics in sports medicine at USF. He also serves as head team physician for USF Intercollegiate Athletics and as team physician for the Tampa Bay Buccaneers. Dr. Kevin Elder from Baycare Medical Group Sports Medicine in Tampa. Dr. Elder is an affiliate associate professor for USF and affiliate assistant professor for FSU Departments of Medicine. He is team physician for U.S. Soccer, the U.S. Ski Team, and the Toronto Raptors, and also sports medicine consultant for the Tampa Bay Rays, Tampa Bay Lightning, and Tampa Bay Rowdies. Mrs. Lacey Bracken, who is a licensed and certified athletic trainer for Stanton College Prep School in Jacksonville, a recent graduate of the Project 17 Certified Athletic Trainer Initiative, and currently a doctoral student at Florida International University. Before we begin our formal discussion on sports safety in Florida, I would like to introduce you to Mrs. Lori Martin Giordano. Mrs. Giordano has been an active and vocal parent in regard to sports safety in Florida since the untimely death of her son Zachary Martin in 2017 due to exertional heat stroke while at football practice in Fort Myers. It was Lori's passion that has motivated our state legislature to pass the Zachary Martin Act in 2020, and further encouraged our group to create this educational program for parents and student athletes. Mrs. Giordano is the president and co-founder of the Zach Martin Memorial Foundation, a nonprofit foundation in Florida that is helping school programs prepare for heat safety. In 2018, Mrs. Giordano was named an ambassador for the Corey Stringer Institute. Welcome, Lori. Thank you for being part of our program.
As a parent of a high school athlete who passed away from practicing the sport he loved, I wish I would have known what exertional heat stroke is and the danger it poses. Exertional heat stroke is one of the top 3 causes of sudden death in high school athletes. It is the only one that is entirely preventable and has had 100% survivability with prompt on-site care with cold water immersion. Legislative measures such as the Zachary Martin Act and policies enacted by the FHSAA have been established to ensure prevention methods are in place and that education and equipment are available for school personnel and students. However, there is room to do more. My hope is that as a parent or guardian, you will take this opportunity to learn about the risks of playing high school sports and how you can ensure your students' health by supporting your school's commitment to protecting the safety of their students.
As mentioned, catastrophic injury can occur in high school sports. Experts and experience tells us the top deadliest risks of high school sports include sudden cardiac arrest, generally an electrical issue that affects the heart due to a congenital abnormality, or something as simple as a collision or impact to the chest. This impact disrupts the electrical impulses of the heart, which becomes an emergency. Exertional heat stroke, a condition where the body has lost its ability to cool itself down and the internal temperature of the body becomes extremely dangerous. Head injury is always a concern in sports. Some sports wear protective equipment to prevent against skull fractures and other impact injuries. But injuries like concussions are brain injuries that require quick action and appropriate care to ensure complete recovery. Asthma is also considered a deadly risk in sports, and sadly, there have been high school sports deaths here in Florida due to asthma attack. Many kids are diagnosed with asthma and are safe to engage in sports activities. However, it is important to review some key items to make their experience even safer. To begin our discussion on the top deadliest risks of sports, sudden cardiac arrest, please welcome Mrs. Lacey Bracken, head athletic trainer for Stanton College Prep in Jacksonville.
Emergencies like cardiac arrest are never predictable, but prevention strategies are in place. The state of Florida and the FHSAA require all coaches and prospective student athletes to watch a video annually to review the signs and symptoms of cardiac arrest. Parents are also encouraged to view the free resource published by the National Federation of High School Sports. Before any participation, state law requires students to undergo a pre-participation physical exam. This exam ideally can reveal any concerning conditions that might predispose a young athlete to injury. Preferably, a healthcare provider familiar with your student performs this exam. The best outcomes are when this provider is also familiar with the specific demands of physical activity in sports. State policy requires this exam is to be documented on the FHSAA EL2 form. The EL2 form includes personal and family medical history questions. The answers to these questions are critical in guiding the exam. Please help your student athlete complete these questions to ensure the answers received are the most accurate response. Sometimes a doctor may order some additional testing, which can sometimes include some types of cardiac testing if appropriate. State law also requires all schools to have automatic external defibrillators available in the event of cardiac emergency. AEDs are special computers designed to deliver a shock to someone suffering cardiac arrest. They should be strategically located within all schools and close to athletic venues. Many coaches and staff members have received training in CPR and have practiced how to use the AED in case of an emergency. Some schools also have staff like certified athletic trainers and maybe other volunteer healthcare providers that are also trained to recognize and respond to emergencies. From a parent's perspective, be sure all of your students' paperwork is completed and submitted to the school well before participation in sports begins. Don't be afraid to ask questions of the school, such as, does my kid's school have any AEDs and where are they located? Who is trained to use the AEDs? Are they present at practices and games? Who is the athletic trainer, team physician, or other medical provider?
Now joining us from the University of South Florida is Dr. Eric Corris to speak on exertional heat illness and heat stroke.
Exertional heat stroke is a major concern, and kids have died, unfortunately, in Florida and other states in recent years from their bodies getting too hot during sports participation. It's critical that all parents and student athletes are familiar with the risks of participation in sport when it comes to the heat, because with the proper precautions, we can prevent most all heat-related injuries. First, all of us educating ourselves, and particularly parents, student athletes, and coaches, to learn as much as you can about exertional heat stroke. A great place to start is with the National Federation of High Schools educational video available free of charge. This is required of all coaches and student athletes and strongly recommended to parents. Next, understand the importance of nutrition and hydration in preventing heat-related illness. An important way our body tries to cool itself down is by sweating. Keeping your body completely hydrated is critical. Students should become familiar with how urine color can help guide their hydration goals, and also about how being familiar with their body weight pre and post exercise, how this fluctuates with sports participation and is most likely a direct response to loss of fluid. Replacing the lost fluids with practice with a combination of water and sports drinks is needed to replace the fluid loss at a rate of about 16 ounces to 20 ounces per pound of fluid loss during practice. And trying to replace that prior to the next practice is a great way to protect yourself from further heat-related illness. A 50-50 combination of sports drink and water is a common, easy-to-remember strategy that can replace your fluid losses as well as your electrolyte or salt losses in your blood. To help our athletes adjust to warm weather participation, the Florida High School Athletic Association requires all coaches and teams to conform to a gradual acclimatization process getting used to the heat. This policy restricts all practices to a maximum 3-hour session with modifications guided by monitoring the environmental conditions on the field. The maximum allowed time for coaches to work with athletes is 5 hours per day, which would include weightlifting and meetings along with scheduled practices. Rest is also a very important part of being a competitive athlete. Students should be getting at least 8 hours of sleep every night to allow the body to recover from intense workouts, especially in the heat. Take some time to talk with your student to help them manage their time to allow for this important recovery time. Even though preventative measures are taken, there remains a risk of injury due to the heat. Should an athlete be suffering from heat stress, actions will be taken to cool them down as quickly as possible. Sports medicine experts recommend cold water immersion for students who may be suffering heat stroke. All students and coaches should be familiar with the location of the tub, the ice, and how to assist someone who may need help with acute exertional heat stroke. Exertional heat stroke is a medical emergency. Heat stroke occurs when the internal body temperature has become uncontrolled, which can happen when the air temperature is warm, the humidity is high, and the sun is shining brightly. Students can be especially vulnerable to this dangerous condition when taking certain medications, abusing legal or illegal substances, recovering from a recent illness, or not caring for their bodies by getting proper rest, nutrition, and hydration. We do know that heat stroke seems to affect athletes who are not conditioned or acclimatized at a higher rate than other athletes. However, everyone who's performing exertional activities in the heat is at risk. Our state policies now emphasize our commitment to safety for our students who participate in sports activities and require on-site monitoring of heat stress levels. This is done by using a special thermometer or on-campus weather stem device that monitors air temperature, humidity levels, and the radiant temperature of the sun. These measurements produce what is called the wet bulb globe temperature reading, and this is different than the heat index and provides a more useful measure for coaches to use to reference when certain modifications are needed for safety in practice. This wet bulb globe temperature reading is compared to a modification chart to help guide coaches and administrators regarding heat stress safety. Because of these new safety protocols, you may notice some differences, including early or late practice times, possible alterations to game times, and more water breaks. Please remember, we're making these modifications to help keep all athletes, staff, and spectators safe from heat-related issues. In recent years, the Florida High School Athletic Association has implemented what's referred to as an acclimatization policy. This policy helps guide the first 14 days of practice in any sport. Research has shown the highest degree of vulnerability for a student athlete is within the first 14 days of practice while the body is adjusting to the increased workload in hot, humid temperatures. Individual school policies will guide our coaches after day 14, but safeguards will remain in place for all athletes. As a parent, we want you to be familiar with this dangerous condition and encourage you to learn more about how to best help your student to recover after all practice sessions and games. Visiting with your student's healthcare provider to review nutritional, rest, and hydration goals is critical. Monitoring urine color and output are two easy ways to determine hydration levels. A young athlete should be urinating at least 6 to 8 times daily, and the color of output should be light colored like lemonade versus dark colored like iced tea. Darker urine indicates dehydration. Monitoring the body weight of your student when workouts begin is a great way of helping them understand what amount of fluid is required to replace what was used during the workout. For this method, it's best to have a pre-workout weight and a post-workout weight. By monitoring the difference between these numbers, the athlete can now calculate replacement fluid volume. For every pound lost, drink 16 to 20 ounces of fluids, usually a mix of water and sports drink. Parents, please monitor this acclimatization process. Understand what strategy the coach is using for practice sessions and when time is allotted for rest and recovery. Students who miss a session must work with coaches to make up the session prior to advancing for safety reasons. We're faced with many challenges for acclimatization. These include preseason or summertime workouts, early season workouts, after-school practices, and certain game times. Because of these many changes, our acclimatization prep may cross several different time spans, and it's always important for parents to remain vigilant of any signs or symptoms that may indicate that a student is struggling with the heat. Should this occur, please notify your athletic trainer, coaches, or your healthcare provider. Should the coaches or staff suspect a student struggling with the heat, the student will be immediately taken to the cooling zone and/or to the emergency room. Heat illness is a more common reaction to participation in the heat. Heat illness does not always precede heat stroke, so it's important that everyone understands we do not wait for certain steps to occur before an emergency is declared. This slide lists some of the common symptoms for parents, coaches, and staff members to be familiar with as an indication someone may be struggling with the heat. Students who have become ill due to the heat should seek the care of a medical provider and follow their guidance for returning to activity and to avoid further injury. When does this become a medical emergency? When a student's core body temperature exceeds 104 degrees, or he or she is showing signs of central nervous system dysfunction, such as irrational behavior, altered consciousness, unconsciousness, or collapse. Our emergency action plan prepared for this situation includes recognizing a student needs help and requesting medical assistance from the athletic trainer or emergency medical services, and if immediately available, for proper diagnosis. If there's not a medical professional immediately accessible, our coaches will begin rapid cold water immersion using our on-site cooling tub, and a response team will be sent to activate a 911 call while others prepare to meet EMS on arrival. As part of the emergency action plan, our school athletic staff meets with local EMS to review a cool first, transport second approach that's deemed the best practice approach by leading sports medicine experts.
Thank you, Dr. Corus, for that great information on exertional heat illness and exertional heat stroke. Let me please welcome Dr. Jennifer Maynard to speak on head injury and concussion in sports.
Without surprise, head injuries are another major concern in sport activities. The state of Florida, as well as the Florida High School Athletic Association, are doing a great job in providing our school's leadership and policy to follow regarding the important information we need to keep kids safe if they sustain a head injury. Once again, educational materials are required for coaches and students and are highly recommended for parents. It is critical that we are all on the same page regarding these safety strategies. Head injuries can include skull fractures and other medical emergencies. Safety equipment like helmets are used for some sports to protect the head from these types of catastrophic injuries. However, injuries like concussions are very different. Concussions are brain injuries that can occur from participation in really any sport. Concussions can occur from a bump or blow, which creates an impact to the head or other part of the body that can affect the brain. Concussions are very common in sports and are very dangerous, especially if we do not identify them as soon as possible. Concussions may be confusing. They can have many symptoms from headache, confusion, and dizziness that make them obvious, or occasionally have only minimal or subtle symptoms which can make them challenging to detect. Sometimes students do not even know they are having symptoms, or sometimes students may try to hide these symptoms they are having to be considered tough or avoid the risk of missing a game or practice. These actions are dangerous, as concussions are brain injuries, and we need to do what we can to make sure they are properly evaluated prior to further activity. It is important that a student who has sustained a head injury is evaluated by an appropriate physician prior to any return to activity. Florida state law requires coaches and staff or parents to remove a student from activity and direct them to healthcare resources in the event of a suspected head injury. An appropriate healthcare provider is defined by the Florida High School Athletic Association concussion policy as a medical doctor, MD, or a doctor of osteopathic medicine, DO, who is familiar with the most current evaluation and treatment protocols for sports-related concussion. While it may seem frustrating at times, these policies and procedures are in place for the safety of all students. When in doubt, we will sit them out. Some gentle reminders: helmets prevent against fractures and other catastrophic trauma, but they are not specifically designed to prevent concussion. Coaches are coaches. Their job is to recognize when a student may become injured, and it is their job to restrict a student from further participation until an appropriate healthcare provider has examined and initiated a return to sport protocol. Athletic trainers are healthcare professionals who work with physicians to keep our children safe. They should be notified in the case of an injury, but especially for a head injury. An athletic trainer can provide an expert opinion and help parents navigate the healthcare system to get the care needed for the student when necessary. Working together is important when a student is injured. Everyone plays a part in keeping kids safe. If you see something, say something. Returning to play after a head injury is an important concept to understand. Should your student experience a concussion, please know that most concussions usually resolve in about 7 to 10 days. However, this can vary for some reason, and in some athletes may take up to 2 to 4 weeks to return to normal. Students must report an injury as soon as it occurs. This helps to avoid further injury, and it immediately begins the recovery process. When kids delay the start of this recovery process, they may prolong the time away from sports. Parents need to become familiar with the FHSAA AT18 form. This form is the only acceptable documentation for a Florida state school to receive after a concussive injury. There are 2 pages. Page 1, once completed by the treating physician, will allow the student to gradually return to increased physical activity under the supervision of an athletic trainer or coach. Page 2 allows the physician a chance to review the notes from the supervising athletic trainer or coach, and then allows the physician to provide a return to competition certification. Under no circumstances should both of these forms be completed on the same date. Remember, all original forms must be on file with the school prior to any return to conditioning, practice, or competition, regardless of the sport. This includes separate sports and separate seasons as well. For example, if a young lady sustains a concussion during fall volleyball season, she must successfully complete a return to activity protocol and have the documentation in place prior to her trying out for the spring softball season. Please work together with your student and his or her coaches and staff to make sports a safe experience. Become familiar with concussion-like symptoms and speak with your student on properly communicating these symptoms to the athletic trainer, coach, or yourself so that proper care can begin immediately. All head injuries are serious. Repeat head injuries can be dangerous.
Thank you, Dr. Maynard. Your experience with treating sports-related concussion is dynamic, and we definitely appreciate your expert opinion and comments on keeping our kids safe. Next, we'd like to invite Dr. Kevin Elder, who is going to talk to us a little bit about students with asthma.
Today we're going to talk about asthma and exercise-induced bronchoconstriction, or EIB. There is a difference between the two. Essentially, the exercise-induced bronchoconstriction, or sometimes referred to exercise-induced asthma, but we'll call it EIB, occurs in athletes at a similar prevalence as that what we see in the general population, which is 9 to 15%. It is important to identify these students. Asthma may go unrecognized. The differences between asthma and EIB, well, one of the differences is that there is testing available to differentiate between the two, and that's predominantly lung function tests will be able to reveal that. Also, asthma may produce symptoms at all times or seasonally associated with allergens, while EIB is bronchospasm triggered by exercise. Both of these conditions, however, are treated with metered dose inhalers. Pulmonary disease in general accounts for 2% of sudden death in sports. Asthma and EIB can be treated with pre-exercise medication in most patients. These conditions should not be a reason to avoid exercise. So when we talk about asthma, what are the symptoms? How do I identify it? Well, the symptoms in asthma come from narrowing of the airway. With airway smooth muscle contraction, this creates also mucus plug production, and this is where you see the wheezing, which we can see that result in increased respiratory effort, difficulty breathing, anxiety, decreased speech, pursed lips, increased respiratory rate, sweating, increased heart rate. Exercise-induced bronchoconstriction, or EIB, is commonly triggered by exercising in the cold, dry air, or environmental pollutants. So what is the treatment of an athlete with breathing difficulties? Well, what's important is that we get quick relief and also preventative treatment. The predominant predominant medication we want to be using are short-acting beta agonists, albuterol, salbutamol, levobuterol. These are most effective therapy for quick relief of EIB, and these are supplied via the MDI, or meter dose inhaler. All athletes who report exercise-related symptoms must have access to their short-acting bronchodilator or their meter dose inhaler for quick relief. How is this administered? Well, it's 2 to 4 inhalations or 2 to 4 puffs are generally sufficient. EIB, they should be using this 15 minutes before exercise, not waiting for symptom onset, but if they know they have EIB, they should use this preventatively. They may need additional medications to control and well, and if no better, certainly very important to notify the athletic trainer, coach, or EMT. And then finally, inhaler responsibility of the student. No inhaler, no participation. This is important that the student takes responsibility to make sure it's in their gym bag for travel or away games. Don't want to get to an away site and not have that MDI.
Thank you, Dr. Elder. On behalf of the Florida Alliance for Sports Medicine, our esteemed panel of guest presenters, and the Florida High School Athletic Association Sports Medicine Advisory Committee, thank you for taking time to view this recorded presentation. The state of Florida and the FHSAA are committed to the highest sports safety standards. We want your student to enjoy a positive sports experience free from injury. In the event that an injury does occur, additional safeguards are in place to empower the coaches and the school staff members to take action. As a parent, please know you are an integral member of the sports safety team. Once again, for specific questions about how your school is prioritizing student-athlete safety, speak with your school athletic trainer or athletic administrator. Website addresses are included on this slide for both FASMed and the FHSAA, where you can find other important information on sports safety. This concludes our program. Thank you for viewing.